All right, everyone. I like to be respectful of everybody's time. It's 3:01. Seems like a very good time for us to start. Um, Thank you all for attending. I can see already this is our highest attended webinar so far. It's a reasonable assumption that that is because I keep doing better as a moderator and not because we have our Chief Clinical Officer participating. The purpose of this, folks, is to allow members of the dental public to ask any questions of our team of wizards. You can see the team on board, and we're going to have everybody introduce themselves in a second, but we call these sessions Ask Me Anything because that is truly our goal. Wherever possible and however possible, we want to make sure that we are asking questions that are of direct interest to folks who are following Aspen Dental, remotely interested in the dental industry. Whoever you are, this is your opportunity to pose the questions. The theme today is the new normal and how the patient and procurement and care provider experiences are changing as a result of COVID-19. Once again, my name is Joel Lowsky. I'm the Director of Academic and Industry Relations, and my role in this is as a moderator. And so I'm going to turn it over now to our panelists. I'm thrilled to have them here, and we'll do some introductions and then we'll dive right in. There's a Q&A option at the bottom of your Zoom window. Please feel free to use that, and I see some folks already have. You can also submit online anonymously via a form that you would have received when you registered for the event. We have surpassed 3-digit attendee number, so without further ado, let's start. Dr. Judge, please go ahead.
Great, thanks, Joel. And I'm not sure if we're wizards, but we're trying to do our best over here. I'm Dr. Arwinder, Judge. I'm the Chief Clinical Officer here at Aspen Dental. In a nutshell, my role is really just the professional development of doctors and really trying to help doctors get to their goals. So doctors will come to us, and our job is really to try to put them into business. And so we try to help them with their development from a clinical standpoint, business standpoint, leadership standpoint. And what I like to do with each and every single doctor, and my team works really hard with them, is how do I get you to your goals? And the person's goals might be different than somebody else's goals, right? So if somebody wants to be the best associate around and develop into that from a clinical standpoint, we want to try to help them get there. If they want to develop and own a single practice, that's great. We want to help them get there. If they want to own over 20 practices, we want to help them get there also. So I could probably go on for hours, Joel, but I'll hand it off to Amy Rhone now so she can introduce herself.
Thanks, Dr. Judge. Good afternoon, everybody. I am the Vice President for Compliance and Risk Management. I've been with Aspen Dental for just over 4 years. I've spent my entire career in the healthcare field. A majority of the time has been in the health system arena, so the acute arena, outpatient, as well as clinics involving dental services historically. So my role here at Aspen Dental is to work with the teams and help them figure out complicated situations. So one of our core objectives is to essentially understand the regulatory environment and figure out ways to help make the lives of dentists and their teams easier and facilitate programs and processes to help comply with rules and regulations, ethical business standards, and just the culture and the mission of the brand and of their individual organization. I will now turn it over to Jacob.
Yes, Jacob Allen, Vice President of Supply Chain for Aspen Dental Management, Inc. I started with Aspen Dental about 3 years ago. My background is in global logistics, manufacturing, transportation, and supply chain. I lead the purchasing, sourcing, logistics functions for Aspen Dental. My role is really obtaining, sourcing, clinical equipment, clinical supplies, as well as corporate indirect goods and services, and ensuring that we've got the highest level of quality, we've got continuity of supply, and that we've got the best manufacturers and distributors available for our clinicians and for our teams out there. And I'll turn it over to Brian for his introduction.
Thanks, Jacob. Brian Bay, Director of Risk Management and Loss Prevention for ADMI. Been with the company a little over 10 years. My area of responsibility includes procurement of all of the insurance programs for the organization, along with addressing those regulatory questions, developing standard operating procedures to meet OSHA and other regulatory requirements. And my background, practicing paramedic for 25 years, so that's my clinical background. I'm going to turn it back over to Joel.
Well, thanks everybody. So once again, there's the Q&A option at the bottom of your Zoom window, but I'm going to start with a question here from our public forum. It seems to be a very good way for us to start. So how is Aspen Dental preparing for PPE disinfecting procedures if PPE will be reused? Amy, do you want to take that one?
Sure. So anytime we introduce a new piece of personal protective equipment, during our analysis, we understand how those particular products can be sterilized or decontaminated. And we use essentially not only manufacturers' guidelines, but also industry best practices like we see coming out of the CDC. So during different times, we may have different modalities available to us, and we look at a variety of ways to do that. But generally, it's specifically unique to the individual products we're using. And we look to associations like the American Dental Association and the Centers for Disease to basically give us advice on how to properly extend the use, especially in instances where PPE can be decontaminated or sterilized.
Thank you, Amy. I appreciate that. So the question just popped in. I'm going to read it right off here. Those evaluations of those products, are you performing that? Are your team performing that on behalf of the practices, or are the practices directly involved in that?
I can build on that one. It's a little bit of both. I mean, for everything we source and everything that comes into the supply chain, we look at it from a few different angles. There's the commercial supply aspect of it. There's a clinical aspect of it, with working with our clinical staff and with doctors out in the field to test and evaluate products with us. But then there's also the risk management component of it. We're looking at the certifications and the testing and lab results, whether it takes an FDA mark or a CE mark or NIOSH or whatever the various standards of certifications are. But it's very much a balanced approach between clinical supply chain and a risk perspective as we introduce products into the supply chain.
Great, thank you. At each practice, who is responsible for making sure that cleaning and sanitation is happening correctly, and at regular intervals? Amy, do you want to take that one?
Sure. So we have a few different strategies that are utilized because there's different cleaning techniques and timeframes that the dental teams are working with depending on services that are being provided in the office. So generally, the clinical staff are ultimately responsible for the cleaning of any of the dental treatment areas and following standard operating procedures, which are well defined and documented across the organizations, as well as the kind of high traffic non-clinical settings. And in those instances, the office managers are ultimately responsible for making sure that the cleaning and sanitation rotations are taking place. And even if they're responsible, even if they delegate that to somebody else, ultimately it's the office manager making sure those standard procedures are being followed as they're written for each of the organizations.
Great, thank you, Amy. Anybody want to add to that? I thought I saw interest.
Hey, Joel, maybe it might help the group understand, because I think we have different kinds of participants here. You have probably vendors, you got private practice dentists on, you got some of our teams on. It might just help to just give everyone an understanding of who Aspen Dental is, and I can help you with that. Currently, Aspen Dental is about 850 locations in 41 states. We're the largest dental support organization in the United States that's branded. I think we're the largest in the world, and some people say in the universe, but I can't confirm that yet. So there's over 200 dentists that own these practices. So each and every single practice is owned by a doctor, by a dentist. And really those dentists are the ones who help propel and help us with their growth. We open a practice every 4 days. This is pre-COVID. We open the practice every 4 days. Things like get slowed down for private practices. Are slowed down as for us in the middle for now. We feel like it's a hurdle that's that all of us are kind of dealing with at this point. We anticipate getting back to the 85 new office openings per year, hoping by next year. And listen, our group over here, the team that's over here, and Joel, you and your team, as you guys all know, we provide the back-end support for the doctors. We negotiate the best pricing. We work with from an HR standpoint, you name it, anything and everything that probably doctors are not trained on or developed on in dental school. Those are the services that we provide. We have two support centers of 80,000 square feet in Syracuse. We got a 45,000 square foot center in Arizona. We have another one in Chicago. In Chicago, we're going to be opening a brand new learning and development center, which is going to be about 200 to 300,000 square feet. That's going to be opening up next year. And to give people some kind of sense of the scale of the organization, on an average day, pre-COVID again, we're getting about 20,000 new patient calls, 20,000 patient calls to our call center. You have over 25,000 visits to a dental office. So in an annual kind of basis, you're looking at about 7, 8, 9 million patient visits in that particular year. So I thought we would give a sense of it, because I think when I'm hearing some of these questions, the doctors own these practices, and the doctor could have one practice, or the doctor might have over 20 practices. And we work closely with those owner doctors to provide them the right amount of support, provide them, as example, for Jacob to go and get the best supplies, negotiate the best pricing that's available. Amy's going to work with risk, and Brian are going to work with risk to make sure that we're supporting the doctors the right way. Because of the 41 states, every single state might have a few different regulations. And that's where, like, this team has done a phenomenal job over this last few weeks. I'm so proud of them trying to decipher county by county, state by state, on what's going on in each and every single state. And so they've done a great job. And their job is to try to get the latest information in front of the doctors, help with guidelines and recommendations. And then at the very, listen, the doctors who own these practices are the ones who are making decisions, or the final decision on how they want to practice within those practices. So I hope that helps.
Thank you, Dr. Judge. That does help. In fact, we've had a bunch of questions come in while you were speaking. So you mentioned the new training center in Chicago. So how are we training people to implement and use the new safety devices and procedures?
Is that for me, or is that for somebody else?
Yeah, go ahead, Dr. Judge.
So when you think about the safety, I mean, there's patient safety, and listen, all the offices have gone paperless. They were heading paperless, but we moved quickly on that, and so all the offices are paperless now. So when you think about a safety standpoint, there's multiple areas. You've got the patient area. How are the patients coming into the offices? And Amy, her team's done a phenomenal job. ADA recommendations, CDC recommendations, all those recommendations, you get them together and you go, okay, once a patient enters an office, should there be a reception area, should there not be a reception area? And generally, patients are moving straight from vehicles straight into the operatories, where they're going to get, beyond the triage that we do prior to them coming even into the office. There's a team safety component also. And again, the risk team here has worked on guidelines related to that, on making sure that team members are healthy, safe as they come in. And then you go beyond that. You think about some of the devices that you can use in the office, from intraoral suction devices to extraoral suction devices to UV lights and the air purification systems. And this team's worked hard on providing options for the owner doctors so they can make the right decisions for their practices.
A question just came in on that note. Are you implementing the use of hydrogen peroxide as a disinfectant? And then there's a note here. It says it's cheap and available.
Well, I'm not sure if it's a disinfectant, but what we're recommending is hydrogen peroxide, just like the ADA has recommended and multiple states have recommended, using it as a pre-rinse before doing any treatment. I don't know, Amy, would you add anything to that? I think you're on mute, Amy.
Sorry, I was. What is important to know and remember is that every single dental practice, being independently owned and operated by a dentist, has the ability to decide what is the best tools that they want to use to achieve, safety and excellent standards of care. And so our role is to really offer them a variety of options available to them based on industry standards. And so we give them a list of potential things to consider, and they can really customize it to their needs. And they know their patients the best. They know their communities the best. They're the ones working with their teams every single day. And so our strategy has really been, whether it be recommending hydrogen peroxide as an agent to consider using for rinsing prior to a service, or using high volume evacuation suction. Those are all industry-based recommendations that we make available and we make to those practice owners and allow them ultimately to decide what's the best strategy for them in their setting so they can achieve their optimum results.
Thank you, Amy. That ties into the question that we have here. You mentioned the team members. How have the team members reacted to these changes? Are we seeing folks that are afraid to come back to work?
I'll take that one. So the reality is, in this environment, whether it be in the healthcare field, the dental field, or any other business environment, there is some nervousness about returning to work, and it doesn't matter the setting. The reality is it's a new virus, and people are still trying to kind of figure their way about how we go about our personal lives as well as our professional lives. So while some team members may be a little concerned about returning, it's natural for them to feel that way, and we're extremely supportive in trying to help them work through all of those normal jitters or normal questions that they may have as they return to work. What I can say is that generally the teams have done a phenomenal job getting back to what we call this new norm, and really being focused on being there for their patients, whether it be in an emergency situation or an urgent situation, and providing the outstanding care that they provide every single day. So I think that the new norm is going to take us a little bit of time to get used to, and if anybody says that nobody should be nervous returning, it's not true, because we're all kind of navigating it ourselves. But we're confident that we provided our teams that we support with the best safety strategies for team members and patients. So when they do return, they're doing so in a safe environment that they can feel supported in.
Thank you, Amy. And I think this one might be for you as well. How are you helping the practices in managing patient schedules in order to help limit exposure?
So within the recommended safety strategies for patients as well as team members, there's various considerations we've encouraged the practice owners to think through. In addition, we take a very focused look at every single state's regulatory environment as the offices are given permission to reopen to non-emergency, non-urgent services. And so while we may make some recommendations based on safety strategies, ultimately it goes back to the practice owner to decide what he or she believes to be the best scheduling strategy for their teams, given what their patient needs are in their communities.
Joel, I'll just add into that. As Amy said, there's states are, they behave very differently. For example, Texas, the recommendation out of that board is to see one patient at a time, work through that one patient prior to moving to another operatory. And then other states behave differently. I think really the recommendation from us, and the owners feel strongly about this, is let's go into it. Let's go make sure our teams are reassured we're behaving the right way, we're treating them the right way, taking care of them the right way, they have the right PPE, as Amy had mentioned. But also at the same time, let's make sure that we go a little bit slower at the start. What we're finding is that after 2-3 days, people get more comfortable. They understand what everyone's calling the new normal is, and they're able to work through it. And then suddenly speed can pick up at that time. But again, right now it's really just trying to get people comfortable back into the offices and making sure the patients are taken care of the right way and the patients feel comfortable coming into the offices. The interesting thing is this: there's a lot of pent-up demand out there right now. There are a lot of patients in need, and they need to get into a dental office soon. And again, like during this 8-9 week time period, one of the other things that I'm really proud of is our teams and the private doctors out there and all the dentists out there that stayed open to try to keep emergencies out of the hospitals. So I think the teams, the communities have done great and given back quite a bit. And now really it's how do we get people back into the practices feeling good about going in through the practices.
Thank you, Dr. Judge. Brian and Jacob, I have questions for you in the queue. I'm trying to keep everything a little bit thematically linked, so don't think you just have to sit there the whole time. We'll come right to you. But Dr. Judge, I think this question follows up nicely with your previous response. Is Aspen Dental using virtual care for patients who don't feel comfortable coming into offices?
The answer is yes to that. And listen, the theme that you're hearing from me is that I'm really proud of the teams, and I'll just tell you something that within a couple-week period, we were able to set up virtual care across the country, and that will continue. I mean, there's a consumer now, which is the patient, that's going to behave a little bit differently or very differently than pre-COVID times. And I think this is one thing for everyone to think through is that how do you take care of that patient? And then prior to COVID coming in, people might not have loved other kind of vehicles. And I'm not saying to try to deliver care differently, but we need to be open during this time on making sure that we can be able to deliver some of the things that the patients need. And they're going to, you know, some of them are going to be afraid to come in. Some of them are at high risk, and they might want to stay at home, and they might want to just put in a phone call or teleconference with a dentist. And we want to make sure we're available to help those patients out as well.
Thank you, Dr. Judge. I'll share an anecdote here real quick before we move on to some questions we have about masks. A friend of mine who's a managing clinical director at a practice in Vermont told me that his practice owner has opened up for teledentistry, and in a response to not every dentist being able to work during this difficult time, he split his workforce so that some dentists were practicing emergency dentistry in the office and others were practicing teledentistry. And so that was a nice way to share any potential revenues so that folks could keep working. Okay, so we've got some questions about the masks. Jacob, let's start with this one. Do offices order PPE from suppliers, or do they place their order for PPE from Aspen Dental Management?
Aspen Dental Management helps to facilitate the order of the PPE with a qualified and validated network of suppliers that has specific item codes, that have specific descriptions, strengths, quantities and pricing that has been negotiated on behalf of the owner doctors in the company at the company wide. So our supply chain, sourcing, purchasing, and logistics teams are really supporting and facilitating that, but centrally ordered, and then we will place the orders on a qualified set of suppliers that have been pre-qualified.
There have been reports in the industry about lower quality or poorly made masks. Have we encountered this, and what are we doing to battle this?
So what I can share about this is, like, we've probably had over, well, let's just even take a step back, like pre-COVID and like leading up to this. When COVID was hitting the China manufacturers and the offshore manufacturers back in Q1, what had happened is it caused a lot of shutdowns. So a lot of the supply that was being generated was being stopped. And then going into Q2, there was severely increased demand globally for products that had not traditionally been in such high demand, which created a really big disruption and imbalance in the supply chain. And then the much needed supplies were being diverted to the healthcare, diverted to the front lines of COVID, and they're being withheld or pulled back through government mandates or other regulations from other classes of trade, dental specialty in other areas. So then that led to rationing programs. It led to shortages of masks, gowns, sanitizers, and all these different types of PPE and things that we're all dealing with on a day-to-day basis. So what I could tell you, like, from a quality perspective, how we think about this and before supplies even get to the practices, they go through a thorough vetting process. We look at the manufacturers, we look at the lab certifications, we'll look at the clinical, the risk, and the supply chain perspective before anything would go out into the field. Have we encountered people trying to defraud the organization or to do different things that might be different during these times? Absolutely, but we've got a very good quality check in place prior to anything getting into the dental practices.
Thank you,
Joel,
Jacob.
one thing I would add to that is we take safety in this organization seriously, and from a brand perspective, it's definitely our priority. So we decided at the onset of all of this global shortage that we were going to work closely together as we always had been, but even more super focused on the safety of the product, and agreed collectively that we would not allow a piece of PPE or supply that we were sourcing to enter the stream until we were confident that it was safe for the team members to use. And so, as Jacob mentioned, it not only included verification of lab testing, but that included us personally testing on multiple levels products that were entering the stream, so we knew at the end of the day our teams that we were supporting were protected during this time and into the future.
Yeah, and out of like hundreds and hundreds of suppliers that we've been working with to qualify over the last, I'd say, 90 days, a very, very few manufacturers and distributors ended up at the bottom of the funnel. It just, weeding out poor quality or bad business practices, or weren't able to meet our, terms and conditions of the sale, prior to it even getting to where it got to. But that's been the approach that we've taken.
Thank you. So with regards to the functional and quality masks, Brian, I think this is a question for you. How is Aspen Dental handling fit testing for the masks?
Yeah, thanks, Joel. You asked me about fit testing for respirators in the dental practice. It's been on the radar screen. And so we moved very quickly with 2 national vendors to perform the fit testing who could meet the needs of the 800 plus practices that apply the Aspen Dental brand. Have we been able to match up completely? No. And we've had individual locations where we've identified local suppliers to perform the fit testing. But we've been very successful at setting up the program. The teams in the offices have embraced having to use the new PPE to fill out a medical questionnaire. They really look at it as thank you for supporting us and making sure we're safe when we operate in the practices. Understanding that the rules from CDC in the states have been relatively fluid. So we've had to continue to update documents and educate the teams and just continue to support them like we normally would, just a different program called respiratory protection.
What's Aspen's approach or perspective on wearing PPE for sort of longer than is typical, or disinfecting them and re-wearing them?
So I'll take that one, and then maybe Dr. Judge can add some commentary to it. So generally, over the past several months, as we've kind of touched on, the PPE environment has changed. What used to be the standard in the dental industry has evolved based on what we learned about the virus and based on what the industry experts were telling us. And so it required us to take a pretty quick strategic approach to making sure we were able to source the right PPE. So what we historically have done and continue to do is look at the industry best practices like the ADA to develop recommendations for practice owners to consider. But those are just that. Those are recommendations, understanding that states could have specific requirements that are different than what we particularly may recommend. But generally, the ADA has been our anchoring source for us to look to, along with the CDC and OSHA, when we are making some recommendations regarding PPE. And, with that said, we're offering them a variety of options for them to consider and to use to best situate what their PPE program is for their particular office based on the dental scenarios that they're experiencing with their team.
Yeah, I think Joel, a lot of the doctors, what they're doing is if they're trying to extend the PPE. So we're talking about the N95 mask really here. People are wearing a surgical mask on top of that, throwing out the surgical mask, keeping that on. As providers, if you put on an N95 and a surgical, the N95 by itself can get really hot. It can get humid. Putting on a surgical mask makes it difficult also. The length of time, there's a variety of different sources on how long you can keep that and extend that. I think we leave that up to the doctors to make those decisions. If you go by what Iowa, the dental board there recommended was about 48 hours that you could go with one mask, as long as it didn't get soiled or too much fluid on it. But the doctors will make those decisions. I know Jacob is working hard to see if we can get a decontamination company online we have one online. It's just making sure that we are satisfied with the outcome as far as how everything goes with that. So, yeah.
Great, thank you. One of the things I enjoy about these Ask Me Anything sessions is that we really get to drill down on the topics that folks are interested in. So I'm going to return to something that we already addressed so we can dive in a little deeper. How are we registering patients for virtual appointments and verifying insurance and collecting pay? Dr. Judge, you want to take that one?
I guess I do. Well, the system that we had set in place when we first started with this was, there were team members on the sidelines. We brought them back quickly. So the regional managers and the office managers, they were able to fit in, so the doctors didn't have to go through some of the payment stuff. So patient calls in, they call through. We used a company called Doxy. We had vetted a few different companies out, but at the time, Doxy was the one that we wanted to use. We unfortunately couldn't integrate right away into our practice management system. Patient calls in, they're going to get a care coordinator who's a regional manager or an office manager who's going to triage the patient the right way and get them into the doctor. They'll try to get as much information as possible, talk through payment terms, talk through the insurance side of the business, so the doctor can just focus in on, hey, let me understand what's going on with you. Let me see how we can help you. Is it something that can be taken care of virtually, or do we need to send you to a practice? And do you qualify? And can we triage you? I mean, when you think about this, offices were only open for emergency services at that time. And so it was a great triaging tool also on who should be coming into the practices and who should not, as we were trying to minimize traffic in the dental practices and make sure that we were abiding by the state guidelines. So the doctors go ahead and recommend the treatment. They will hand it back off to the care coordinator. The care coordinator will take care of everything else.
Thank you. Returning to the topic of masks, I'm combining several questions here. Are all clinical staff required to wear masks? And what are the general recommendations for PPE by procedure?
So I'll take that one to start. So the recommendation is that any individual in the dental office wear a mask, and they wear the appropriate level mask based on the duties that they're performing. So that is something that you would routinely see in the offices at this point in time. And that extends to patients. During various touch points with patients prior to their arrival to the office, we're asking them to remember to bring a face covering. And if they arrive and they don't have one, they are given a face mask while they're in the office. There is a difference between face masks and the respirators. And so what practice owners have the ability to decide based on the procedures that they're rendering what the appropriate PPE is for them and their teams in the office. And so we allow we offer them a variety of options, and they ultimately are the ones to decide based on the risk in their office and the risk within the procedure that they're performing, what the appropriate PPE is for that particular instance.
Yeah, Joel, and also, once again, we're over 41 states, so not one solution fits all. Some states may mandate an N95 for a variety of different types of aerosol, non-aerosol activity, and some states don't. And a lot of them are citing the CDC or the ADA as some of the guidelines. So we provide them the guidelines for their state so they can make those decisions based on aerosol or non-aerosol is really where the decision-making falls into.
Thank you. Changing directions. And just a reminder, I see some folks are using the hands up functionality in Zoom. Please use the Q&A function at the bottom of your Zoom window. Does Aspen Dental help with dental malpractice insurance, both getting it and then helping handle any patient complaints or board complaints that come in? Brian, I think that's you.
Yeah, that's right in my wheelhouse. Thanks, Joel. So yeah, on behalf of the practices and the individual clinicians, we work with a broker to market the insurance program for the corporation, for the individual practices and their individual entities along with the doctors. And with that, we're really from start to finish. So from a patient complaint to a lawsuit to a dental board complaint and everything in between, we're there to assist that practice owner and the clinician with managing that to resolution. So yeah, we have a team of multiple people who help support them when those types of issues come up.
And Brian, is there any change in procedure or anything anticipated change in the event of a COVID case at a practice?
Sure. So, one of the first questions that came up early on was, what's the malpractice carrier's stance on COVID-19? And very early on, we had discussions with the carrier just to make sure there wasn't any concerns with it. And there really wasn't, because the disease is community acquired. And what we've been recommending to the practice owners and the clinicians is to make sure that they're following the standard procedures and make sure they're using PPE and appropriately triaging patients, pre-screening patients, and pre-screening employees before they come on duty. And so we're giving them a tool to operate as safely as they can, given the current circumstances.
Thank you. Dr. Judge, I think this one is for you. What is the recommendation for Aspen Dental practices for waiting between patients seated in an operatory if the previous procedure in that operatory involved aerosols and therefore the potential for the virus to linger? And are we using level 1, 2, or 3 gowns?
Oh, wow. That's a great question. Before I answer that, Brian, just want to give you a heads up. Your phone is cutting in and out. I don't know if other people are noticing that as well. So not sure if you need to get close to the phone or not. Jacob, is there Jacob or Amy, what's the level of gown that we use in the offices?
We have I could take the answer on the level of gowns. So we have multiple level of gowns in the supply chain at this time for multiple distributors and manufacturers. We Amy would probably add on to this, but we try to match the right gown for the right procedure depending on what level of fluid producing procedure it is. And have disposable gowns in inventory for use for the practices. And Amy, if you want to build on that a little bit.
Sure. So as part of our sourcing procedures, we source as many different types and levels of gowns as possible. As Jacob noted earlier on, there's been a global shortage for gowns and other PPE. And so we've been doing our very best to find as many reputable sources as possible to get any and all types of gowns and make them available to the teams in the office so they have something to protect them. So during times of pandemic, when there's global shortages, it does become a little bit of a challenge for the teams to basically, make sure that they're focused on those supplies and that they're getting them in the right way. But at the end of the day, we're erring on the side of providing the highest level gown we can possibly find to make sure that they're protected regardless of the services they're provided in the offices. And so we look to other industries like the urgent care industries and the healthcare industries to take some leads from as well, and have used a variety of relationships to make sure that we're sourcing those gowns appropriately for them to choose which one's the best to use.
Yeah, and like the mask, maybe even more so, the gowns, like global supply of gowns is going to be extremely short for, could be 120 days plus, making it very difficult to source gowns. A lot of the manufacturers in China, started switching gown production to mask production, over the last few weeks, which is making it more challenging and more difficult. But working with the clinical and risk teams to continue to identify new sources of supply to keep people safe, keep people protected.
Thank you. And Dr. Judge, the other half of that question was, what's the delay between using a room in which aerosols were used for the previous procedure?
I'm going to hand that off to Brian, who specializes in Cavicide and all the other disinfectants in the office.
Thanks, Doc. So, ultimately that's going to be up to the clinician based on the state in which they're operating in, because we do know some states are mandating certain procedures occur, certain, timeframes between those. In general, what we have recommended with the teams is that they continue to follow the infection control procedures as put out by CDC or their state regulatory agencies to how you flip an operatory between patients.
I would add just one other thing to that for discussion purposes. Essentially, the offices are very focused on reducing air aerosols whenever possible. And there are a variety of strategies that the doctors have available to them, the hygienists have available to them to help prevent air aerosols even entering the air. So the aerosols themselves not getting into the air. And so we've offered and made available many different options, from administrative controls to engineering controls, that helps to reduce the aerosols being generated at any particular time significantly. And all of the research that we've done and all of the strategies we're using are sufficiently backed by scientific evidence that it does reduce the risk within the environment.
Thank you. Jumping around now again, this I imagine is a question that's been on everybody's mind. I've seen this in my own research. How is Aspen Dental Practices intended to recover the additional costs of PPE? Essentially, I think the question is the cost of dentistry going to go up as a result of this?
Do you want me to take that, Joel?
Sure, thank you.
Listen, it's a great question, because I think typically the cost of PPE before was less than $1 or maybe less than $2, and now it's, every time you're in an operatory, it's $10, $12, $15, $20 to see a patient, $20 to see a patient. And we're working closely with NADP, the ADA, ADSO also, which is the Association of Dental Support Organizations, to work with the insurance companies on a couple of different things. One is there perhaps a way to raise the fees overall to try to account for this additional PPE? Is there a way to perhaps charge for it? There is a code out there. Currently, though, after discussion with the owner doctors, we've decided not to charge patients for this because there's only been a few insurances that have moved on it. So we'll keep an eye on it. We're going to keep, stay close to it, and there'll be some recommendations made afterwards, and we'll see how the owners would like to react to that. But generally, in Aspen Dental, we're not charging for PPE at the present time.
Thank you. How many doctors are you supporting through COVID, and do you know how they're feeling about the support you've been providing?
So we've, in Aspen Dental, there's approximately 1,400 dentists that are being supported, and the vast majority, I haven't heard one negative feeling. I've just heard very positive. The teams have been phenomenal. The doctors have felt well supported. I've got text messages, I've got emails on how good they feel. That, just last week over the weekend on Facebook, my phone was blowing up on there with people, doctors telling me how good they feel about the support. And I think some of the doctors realize we do have an advantage, being a single practice owner or being out there on your own. It's probably hard for you from a negotiation standpoint. So we've had an advantage working with the Henry Scheins of the world and some of the other procurement companies. So I think when the doctors look back at this, and they have the messages that I get and Bob gets and some of the executive team gets are, listen, we couldn't have done it without you. When it came down to, hey, how do I function from an economic standpoint? Should I apply for SBA? Shouldn't I apply? Our teams helped doctors through that. When it came through PPE, how do I work? What do I do? Should I shut my offices down? Should I stay open for emergency services? Our teams and my team over here, they were back there to help the doctors through it. So through each and every single kind of circumstance, I've felt that we've been ahead of the curve. I mean, prior to the ADA releasing some of the guidelines and recommendations, our teams here were up in front and center with recommendations that were put in place to help protect the team. So I think you could probably go to any single owner doctor and they're going to say, listen, they felt really good about how we've behaved and how we've taken care of them throughout this unprecedented time.
Thank you, Dr. Judge. Moving to a different category here, is there an intention on testing doctors and hygienists and assistants for COVID on a regular basis?
Do you want me to take that one? I'll take that one. So testing is definitely something we're consistently talking about with not only amongst this particular group, but also with the practice owners. And because it's something that it's out in the market, we're understanding it, we're looking at it, and we've explored a variety of options available should we collectively, as a brand and as multi-organizations working together, decide to do that. At this particular time, we have opted not to pursue testing. Instead, what we will be doing is continuing to support the teams and making sure that they're operating in the safest way possible, helping them to expedite testing when maybe in the community they are not able to get quick access to testing. But yet we still continue to look at the new and evolving progress being made in both PCR as well as the serology testing. So it's not something we've taken off the table, and we continue to look at it. But at this point in time, we decided it was best to make sure that we're taking care of our team members and our patients in the safest way possible. And right now that does not include doing testing in the location.
Thank you, Amy.
Yeah, Joel, I'll just add into that because Amy's done a lot of work on this and so has Jacob. I mean, we've worked with the leaders from McKesson, from Abbott, Henry Schein, you name it. We wanted to get ahead of it. There's two types of tests. And even though you might be able to do it, there's a lot of questions. Even if you're thinking about this in your own practices, you know, how are you going to manage the patients? Or do patients see this as a positive, or do they see it as a negative? How do the team members feel about this? So it's not simply just testing or not testing. It's what kind of test are you doing, and how beneficial is that test? I mean, if you're doing an antigen test, you're good for the next 5 minutes where you're going to be testing either positive or negative, and you'll get to know. So what do you do with that? And then you go on to, if you had serology types of testing, if you had antibody type of testing, that might make more sense. Do you have immunity? And do you have immunity as you come through? So there's a lot of unanswered questions around this. And I think that's why we've decided at this point it doesn't make sense. The companies are staying very close to us. They're staying very close to us so we can make the right decision moving forward. There might come a time where we do go into testing or make the recommendations, and we work with the owner doctors and see how they feel about it. But that recommendation might come in the future. Right now, frankly, there isn't really that much testing available, to be honest with you, too. So lots of questions around testing right now, and I know that's kind of one of the hot topics with everything going on. But lots of questions around it, and sometimes every time you get to an answer, you might have a few more questions.
Amy, I think this one is for you as well. What is your recommendation regarding checking vital signs of both office members and patients?
So I'm assuming the question is more structured around signs and symptoms versus traditional vital signs. So I'll take it from that strategy. So as part of the safety strategies for both team members and patients, team members are taking signs and symptoms consistent with the CDC recommendations before they even begin their shift. So as soon as they walk in, they do that before changing into their work clothes. Part of that, though, begins even before they arrive at work. We've developed, in consultation with the practice owners, comprehensive sick leave policies. And essentially, the standard is, if you wake up in the morning, ask yourself how you're feeling. And if you're not feeling 100%, then don't come to work, because we want to make sure that you're protected, your teams are protected, the patients are protected. And so it really starts at that moment in time. If an individual gets to work and they're not feeling well, then of course, right, they're sent home. They're encouraged, if they do have signs and symptoms of an illness, to contact their primary care physician so they can make the best decision for them given what their personal health is. As it relates to the patients, there's a series of contacts with patients prior to them entering the office where we are screening on behalf of the practices for COVID-related symptoms, and it happens all the way up until the patient arrives. And so the first thing that patients will experience upon arrival and moving into an operatory or the dental treatment room is these signs and symptom screenings, again, consistent with the CDC guidelines, to make sure before any services are rendered that the patient is feeling well, or what we call a well patient, and is ready to proceed forward with their services. If, again, there's any indication that the patient isn't feeling well and it's not related to a dental matter, then they are rescheduled and basically moved out until a time where they're feeling better.
Thank you very much, Amy. I'll just remind everybody we've got about 10 minutes left. The questions have been flooding in, and it is my intention to try to get to as many as we can. Don't forget you've got that Q&A option at the bottom. We're going to go a bit of a different direction now. Dr. Judge, perhaps, how has the COVID affected the way brand new Aspen Dental clinicians are being trained and mentored?
Well, one of the ways that we're training and developing doctors right now is we can't bring them to a classroom setting. So doctors are really quickly, and again, you know, you've heard this theme from me, and I've said this a couple of times, Joe, but the teams here have worked super hard. Very quickly, you know, Sue Decker, the learning and development team, they went out and they started moving everything virtually. So we have implant courses to take you from basic implants all the way to surgical kinds of treatments and development virtually that are available to the doctors. We have Dr. Galler, who took clear aligners, and he moved the clear aligner academy to a virtual academy so we could start helping doctors who wanted to deliver clear aligners once all of this kind of clears up. So we did that pretty quickly. We moved a lot of our programs that support the doctors, pretty much all our programs, to be available virtually. And not only for the doctors, for the hygienists, the front desk people, the office managers, the list kind of goes on and on and on. So very quickly we moved forward and moved things there. We are, however, I mean, to my Aspen colleagues out there, looking forward to the day that we can come and visit you in the offices and have you travel once again to our locations so we can spend time. I mean, a lot of what we do is we're a family here, and we're a team here, a family here, and it's just nice to kind of get together, break bread. We're pretty emotionally attached at Aspen Dental, even though we have 12,000 members. We feel pretty close to all of them. So we're looking forward to that day. But generally, we've moved everything to a virtual environment right now, Joel.
Thank you, Dr. Judge. So what advice would you give to dental students, particularly those starting a fourth year, and what do you expect the changes to be when it comes for hiring young dentists with regards to COVID?
What I would tell the dental students is this: is keep your chins up, keep your chin up. You're going to get through this. There was a time in the 80s. I'm too young to remember it, but there was a time in the 80s, and so where we had HIV. There was a time when doctors didn't wear any masks. They didn't wear gloves. I remember the first time I went back to my dentist and he wasn't wearing a mask the first time and gloves. The next week I went in, he had gloves and a mask, and I thought my breath must be really terrible or my teeth must be really terrible. I didn't realize that there was some OSHA kind of considerations at that time. So listen, the worries at that time were similar to some of the worries now. I think if you're a dental student, I would say you have a great career that's going to be ahead of you. Keep your chin up. Don't get too stressed. I've had dental students that have graduated recently that are joining the organization that have stressed for a variety of different reasons. If you have the proper PPE, I think you're going to be fine. I think once we get through, and I saw one of the questions there was a statement that came through that patients are going to probably get tired, and I think people are getting into COVID fatigue here. As much as we need to stay alert, people are getting into that, and I think at a certain point, patients just want to get treated. And the doctors, you're going to be able to protect yourselves. Will N95s come and be the standard? Most likely, but I'm not 100% sure there. But the world changes. I mean, after 9/11, the world changed, and how we did security in the airports. People adapted, they moved, they changed. And I thought our lives were going to be very, very different than they are right now in the United States. I mean, I thought we were going to be locked down, movement was going to be difficult. It was going to be a different world after that time period. And we adjusted, we adapted, and we've been successful. And I mean, not just Aspen, I'm talking about the world or the United States. And I think the same thing will happen here. People are going to adapt, and they're going to find a way to become successful. So if you're a dental student, listen, I will tell you, and this is my only plug, come to Aspen Dental, we'll take care of you, and you'll be fine.
And moving off of that plug, now's as good a time as any to mention that our webinar next week is actually called I'm a Recent Grad, I Chose Aspen Dental, Ask Me Why. So please feel free to attend that one. That's next week at this time, hosted by yours truly. Please come. Thank you. We just have a few minutes left. I'm going to pose one more question, and then I'm going to sort of give our panelists an opportunity to talk about anything that they feel hasn't been approached yet. And I think this one is for you, Dr. Rhone. Can you make some suggestions? I'm sorry, Amy. Can you?
Yay!
Dr. Rhone.
You know, it really rolls off the tongue. Can you make some suggestions regarding how the schedule would be optimized, sort of with regards to which patients at which point in the day and at which point in the week and so on?
Sure. So generally, the practice owners themselves have a great understanding of what their patients are and what their patient needs are. But things that we ask them to consider and recommend they consider involves if you have a patient who is at risk for severe respiratory illness or has is compromised for some other reason, we encourage them to schedule those patients whenever it's possible and whenever it makes sense earlier in the day. Not because there's any scientific evidence that we put them at risk any other time, but just generally it seems to make more sense until we get a little bit more comfortable with returning back to non-emergency, non-urgent care. In addition, I think that we've encouraged our teams in the offices and the dental practice owners to think through making sure they have adequate time in between patients to seat the patient, to do their signs and symptom screening, to perform the service, to make sure that there's social distancing in the office, and then ultimately cleaning the operatory following the time frames that cleaning solution needs to sit. And so there is a little bit of an adjustment there from a scheduling perspective that they really have to think through based on how they're choosing to schedule their patients throughout the day. So while there's not a one-size-fits-all rule, there are some standard considerations that I know that the practices are looking at and evaluating based on their patients and their communities that they're serving.
Thank you, Amy. Once again, I want to be mindful of everybody's time. We'll just take another minute or two. I'd like to give the panelists the opportunity to maybe give a response to a question they anticipated might be asked but wasn't asked. And if you don't have one of those on top of mind, and Brian, I'm going to start with you. Is there any advice that you would give from your unique angle on the industry? Is there any advice that you would give to a dentist or a small private practice or to a DSO during these sort of unprecedented time where the normal is becoming reestablished?
I think part of the biggest challenge that folks are going to run into is that there is to some degree conflicting recommendations, especially when you have CDC, FDA, OSHA, governors, dental boards, dental associations, and then you layer on top of that maybe a county health department. So you're ultimately got multiple levels of bureaucracy telling you different things. And so you have to be mindful of who your audience is that regulates you, and you need to go back and look at things on a routine basis. This is definitely not a time period where things are going to be static, and you can get yourself sideways very quickly if you rely on information that gets old, and old could mean yesterday, unfortunately.
Thank you, Brian. Jacob?
Yeah, I would just add, like, in closing, like, this is, from a supply chain perspective, this is probably one of the most unprecedented supply chain events and disruptions that I've certainly seen in my 20-year career, and that many people have seen in their lifetimes. Extreme shortages, extreme disruptions globally has led to some people trying, or some sellers doing some very unnatural things. So I would tell other DSOs or other private practices to just be really, really careful and mindful of the people that you're dealing with, the suppliers that you're dealing with, and the quality of the products that you're sourcing, and make sure you've got property quality checks in place as you're buying these things. And just be certainly careful. You've seen in the news, you see in the media all the fraud and all the different things that are happening out there. But just make sure you're doing your due diligence and you're you're putting your patient safety and your employee safety first at all times.
Thank you, Jacob. Amy?
So I think it's important during this time for people to take a moment and just maybe step back and focus on the basics. There's a lot going on in the environment. As Brian and Jacob both noted, information is changing constantly, and you can get to the point where you feel a little bit overwhelmed with all of the information coming at you, and there's only so much that each of us can do in a particular day. So I would encourage the participants to make sure that you're clear as to who your subject matter experts are, who those industry experts are, and make sure you're taking advantage of them. Don't try to necessarily figure out a complicated situation by yourself, especially if you're in the healthcare industry. You have access to risk management teams and compliance teams out there, and I would encourage the participants in those cases to utilize those resources effectively, because that's what they're there designed to do, and that's something that here at ADMI, we talk about one of our purpose being to support and take care of the people taking care of the patients. And I think that we all collectively feel a strong passion about that, because we know that the clinical teams are on the front lines every single day taking care of the patients and doing the important mission critical business. And so for us, it's really important that we are doing our very best to support them during these unprecedented times.
Thank you, Amy. And Dr. Judge?
Well, first of all, thanks, Joel. I mean, I appreciate you putting this together and the team working hard on this. I want to thank everyone who's joined the call as well. I think just a couple of things. I've talked to experts around the world, from Wuhan to Europe to in the United States. You know, some studies are showing, or some research is showing that there might be about 30% of the offices that have some sort of shutdown or some sort of difficulty following this. And I'm disheartened to think about all those doctors out there that might be in that type of situation. I've heard of doctors dealing with depression and certain things like that. So for all of you that are out there, even if you're not part of Aspen Dental, I'd say, listen, if there's a way we can help you out, if there's a way to get through this, that you need help, we're there for you as well. You know, we want to make ourselves available for all of you. And if there's some tough choices you have to make with your practices, we will help you get creative and think through that if you need any help at all. To our Aspen Dental teams, I would say, listen, thank you for everything that you have done, not only throughout this crisis, but since we've kind of gone through this stuff, and after I'm hoping after the crisis as well. You guys have been pretty phenomenal, and you've really kind of carried and made me proud of every single one of you guys. So thank you for everything that you all do every single day for us. The last thing I would say is that I'm also disheartened a little bit about in dentistry, where things have kind of gone from a hygienist perspective and dentist perspective. Unfortunately, it seems like there's been some friction put in there, and it shouldn't be that way. I think, listen, we all should work together. We should get the hygienists, the doctors, be it in private practice, wherever you are. Let's just kind of, like Amy said, take a step back. Let's all just kind of be rational. We all want the right thing at this time for each and every single person out there, from patients to team members. So let's just work together. But that's pretty much it, Joel. So thank you for everything you guys all do. And I'll hand it back to you, Joel.
Thank you, Dr. Judge. And it's 4:04. It's just about time for us to wind down. I do want to say a very grateful thank you to Jacob, Brian, Amy, and Dr. Judge. I'm happy to report that the number of attendees still on is very close to the number of attendees when we started. Thank you very much for your time. Thank you very much for your questions. Those of you for whom I didn't get a chance to read your questions, I will get back to you personally. Everybody should have received my email address. When you register, please don't hesitate to reach out if you have any questions. Once again, aspendentalce.com's free credited CE available to anybody in the dental industry. A small gift from Aspen Dental to the industry now during these difficult times. There is one question that I didn't read, which I'll read right now. Thank you very much, and best regards from Romania. So I'm thrilled to see the reach of these sessions. Thank you very much, everybody. Take care, be safe, and have a nice day. Bye-bye.